So let's remember when Obamacare was passed. They said you get to keep your doctor, complete lie, keep your plan, complete lie, and you're going to save $2,500 a family, complete lie. So what we've seen since then is the cost of health care has skyrocketed. Instead of saving families $2,500 and saving the government money, it's actually cost the government money, and it's cost family monies all across the country. So Obamacare created a system that left many American families with fewer choices, higher costs, and health care that doesn't fit their needs. Every story I hear in my state of people struggling with Obamacare, it's about they can't afford the premiums, they have to put off treatment because it's too expensive, they have to split their pills in half to make them last longer. I grew up in, like a lot of us, I grew up in a poor family. We didn't have health care. We didn't have health care insurance. When my brother had a significant disease, my mom had to find a hospital 4 hours away because nobody back where I lived would take care of him. So I think it's really important that people have access to health care, actually access to health care that they can afford. The system we have today is broken. It's in a crisis. It has not worked under Obamacare. So I've got a bill. I've been talking to the president about my bill and my colleagues. It's called the More Affordable Health Care Act. It fixes Obamacare. It says if you like your Obamacare, you can keep your Obamacare. But my bill is going to actually drive down costs. In the House, Chairman Pfluger of the Republican Study Committee has endorsed it. And so I'm hoping that over time we can bring everybody together to get something done. What this does, it drives the cost of health care down. It makes you a consumer of health care. Think about food stamps for a second. When we want to help people with food stamps, which we do, we don't say, oh, here, I'm going to give it to the grocery store, and they'll decide what food you get. But in healthcare, what we're doing, we give the money directly to insurance companies. They get to make a decision, or government gets to make a decision. I guess if the government and the grocery store chain was making the decision, we'd eat more broccoli. Maybe that'd be good for us. But what mine does is it says we're going to give the money to the consumer. We at one of our lunches, we had a doctor come in that has a surgery center. He charges less than Medicaid, less than Medicare, great outcomes. So people are coming from all over the world to buy health care cheaper than what Obamacare pays. But when somebody sets up the system that they make all the rules, then there's no creativity. So the way mine's set up, the state gets opt in or opt out. If you like your Obamacare, if a state likes the way it works, just keep it. But if a state doesn't want to, they can still use healthcare.gov. The state exchange continues. We protect people with pre-existing conditions because I agree with Mr. Jacobs. You got to make sure you take care of people with pre-existing, and people have to have a safety net. But we add options, transparency. You ought to know what things cost. I just own an urgent care company. I add all the menus up, all the prices up there, just the menu board, just like Starbucks. We ought to be doing that in healthcare. People will make good decisions. Mr. Bragdon has talked about that, and people will make good decisions. And President Trump has been right. We ought to stop giving the money to the insurance companies, give the money to the consumer, let them make a good choice. And that's what this does. It sets up Trump freedom accounts, and the money will go in there. It can be used for direct health care, can be used for premiums, can be used for co-payments, can be used for deductibles. But what each family could decide what they needed. So we're not going to take anybody's health care away. What we're going to do is provide them the option to spend the money better. So it lets people shop across state lines. Like right now, if I want to go buy something, I can buy a product or a service across state lines. Why can't I buy healthcare across state lines? That doesn't make any sense. So I think Americans deserve the ability to act like consumers, just like we do. We have a safety net for food stamps, which we should. Our safety net for healthcare, we ought to be let the consumer make these choices. And they're always going to make a better choice. I remember before Part D, I asked my mom and dad when they were on Medicare, how much would it take for you to change the pharmacy? They said less than $1 per prescription. They knew that to the dollar. Today, nobody knows what healthcare costs. Somebody else is paying for it. Nobody's shopping. So, Mr. White, the More Affordable Health Care Act includes a tax credit for small businesses to provide health insurance to their employers. You run a health coalition that includes small businesses. Can you talk about what's happened with the small group market, and you think this provision will work to increase coverage by small businesses?
100%. It is your bill meets all the principles that I talked about, and the small business tax credit would go a long way to assisting those small businesses retain their coverage. So basically, since Obamacare was enacted, the small group market has collapsed. It used to be that most small businesses offered their employees coverage. Today, it's about a third. And the exchange, the Obamacare, is made up of about 12 million small business workers. So when the small business dropped their coverage, those people went to Obamacare, where they faced higher premiums, higher deductibles, less access to doctors and drugs. So if you keep people in their small business, if you give an incentive for the small business to offer coverage, they'll get lower premiums, lower deductibles, more access to doctors and drugs. It's pretty simple.
And they get to make their own choice.
And they get to make their own choices.
Mr. Bragdon, the Foundation for Government Accountability has written extensively about shoppable services, price transparency, and the importance of making patients, consumers, bring free market forces into the health insurance marketplace. Tell me what you think about HSAs and directing any insurance subsidy to the patient rather than the large insurance companies.
I think that putting the patient in the driver's seat is transformative. And I'll tell you a story about my oldest son that drives home this point. So my oldest son is on an Obamacare plan. He's an adult now. And he had spine surgery. Only one carrier in Collier County, we live in the same county as Senator Scott, only one insurance carrier had Miami Children's Hospital in network where he received spine surgery. He had a prior authorization that I had to call their national head of government relations to push it through. And then part of his follow-up treatment also had prior authorization to a medical device that cost $3,000, less than his entire deductible. We got approval for that, but the supplier said to us, we know this is going to your son's deductible. If he pays cash, he doesn't have to pay $3,000. We'll sell it to him for $1,500. It's a scam. Literally, it was charging my son for a benefit that was meaningless, prior authorizing something that he could have got for half the price and did, paying cash. So putting money in patients' pockets is transformative.